Bulgaria has started a big PR campaign to boost the vaccination drive. So far, only 20% of the population has been inoculated. Vaccine hesitancy is widespread in this Balkan nation.
I'm very skeptical about these vaccines. They've been developed too fast. I'm not afraid of the coronavirus and I'm not going to get vaccinated.
Bulgaria already has one of the highest COVID-19 mortality rates in the EU. As Western Europe emerges from the pandemic, Bulgaria is facing a harsh winter. Welcome to our COVID-19 special. I'm Monica Jones. Good to have you with us. Now, is it a relic of the Cold War, the fear of a new form of subjugation, or just misinformation? Fact is, Bulgarians have little desire to be vaccinated, even though case numbers are rising.
The head doctor of the COVID station in this Bulgarian hospital refuses to give COVID vaccinations. Atanas Mangarov is a well-known paediatrician at the Hospital for Infectious Diseases. He gives tetanus and measles vaccinations, but not those for COVID-19. No, I don't vaccinate against COVID. It's great for everyone who wants to be vaccinated. Do it, there is a vaccine. But I don't think it is right to force people in the fear that otherwise they can't work and live as normal. That is fascism. COVID vaccine scepticism is widespread in Bulgaria. Here, a party of pro-Russia nationalists protests coronavirus regulations, which had previously been much more relaxed than those in countries like Germany. I refuse to wear a mask. I think it's crazy, idiotic and humiliating. Every doctor I trust has told me not to do it. Because the infection rate is on the rise, the government has implemented new hygiene rules. Clubs are closed and large events can only be held at 50% capacity. Vaccination is eminently possible in Bulgaria. In this shopping centre, it can be done for free and without appointment, but interest is low. Most people don't believe that the vaccine helps, but I think even if it only helps a little, it's better than nothing. When it comes to the vaccine, statistically we're down at the bottom in Europe and in the world. Sadly, we in the Balkans are distrustful and open to myths and fairy tales and fears and unverified information. The young doctor here agrees. Even among medical staff, there are many against the COVID vaccine, he says. And then there's the hesitant government. The worst for me isn't the slow implementation of regulations to fight the pandemic, but that our health system is on the brink of collapse and doctors aren't supporting it. Bulgaria's COVID death rate is higher than that of any other EU state, and clearly so is its vaccine scepticism.
For more, let's bring in Savina Stoitsova. She's an epidemiologist and part of the National COVID Surveillance Team in Bulgaria. She studies vaccine hesitancy in the country. I also say hello to Janina Steiner. She's Professor for Global Health at the Technical University in Munich. Hello to both of you. I would like to start with you, Savina, because COVID mortality rate in Bulgaria is among the highest in the EU. Only about 20% of the population there are vaccinated, and we don't even know that number for sure. We don't know how many people have fake certificates. Why are so many people there, including doctors, hesitant to get vaccinated?
Yes, we have, thank you. We have actually become a cautionary tale of the toll vaccine hesitancy can take. Vaccine hesitancy here is not a new problem. Bulgaria has consistently ranked high on vaccine hesitancy measurements across the planet in different studies. The reasons are different. It depends on the subpopulation you study. It can be very diverse, but one overarching thing that we find in our various interviews and studies we've done is distrust. And this is deep distrust towards institutions, including public health institutions. When that distrust reaches a certain threshold, you have a situation where people will look closer to home for advice at sources that may not be well equipped to provide good information. So that would be relatives, friends, colleagues, and will be reluctant to actually follow guidance coming from standard expert institutions.
Right. I mean, Janina, you, as I mentioned, you were researching about vaccination hesitancy in 8 European countries. How does the situation compare?
So in Bulgaria, we definitely have the highest level of vaccine hesitancy. 59% in our study of men were vaccine hesitant towards the COVID-19 vaccines and 66% of women. And we see several reasons for that based on our qualitative data. So there are 5 key reasons for this vaccine hesitancy. There are fears of side effects, concerns about the potential harmful long-term consequences of the vaccine, especially in view of the recent and quite fast development. Then there are general concerns about the efficacy and quality of the vaccines, partly based on the finding that vaccinated individuals can still transmit the virus. Some of our respondents call into question the threat posed by the pandemic, or they even deny the existence of the COVID-19 pandemic altogether, and therefore they don't see the benefits of getting vaccinated. And then lastly, what was just mentioned by my colleague, one of the key reasons is also distrust towards political elites and the political system altogether. And some of our respondents refer to vaccination as a sort of means of state control or state oppression.
So what do we do about it? I mean, there's obviously sort of false information out there. There is a lot of doubt about the efficacy, conspiracy theories, all of that plays a role. Janina, what would be policy conclusions that emerge from the findings you just mentioned?
Yeah, it's very interesting, this question. And we set out to test different communication strategies so that we can generate an evidence base on how we can reduce vaccine hesitancy. But we find in our study that there's not an outright answer. We find a lot of heterogeneity in terms of how some of these communication strategies work effectively in some countries, but not in others. And in Bulgaria, none of the strategies that we tested, for example, one of the communication messages tried to emphasize the risk reduction achieved by the vaccines. One of the messages tried to emphasize hedonistic benefits and restoration of public life associated with vaccination. And one of the messages pointed to the COVID-19 vaccination passport that could then give individuals certain access rights. But none of these messages proved successful in reducing the hesitancy level in Bulgaria. So actually, the main conclusion from our study is that there's no one-size-fits-all strategy for Europe as such, and that we need to carefully tailor messages to individual countries and better understand the worries and concerns in each target population. And in Bulgaria, this would involve targeting specifically women and more disadvantaged individuals with lower educational background and lower income levels.
Sabina, last question to you. Brief answer, if you could. How do you think could this health literacy in Bulgaria be improved?
It's really a matter of trust here. Communication is key. There's no central one-size-fits-all solution, but we do have people on the ground. Even with hesitant doctors, we have a lot of doctors and professionals on the ground who are actually, they know their communities, they talk to their communities, and they are well equipped to communicate well. What we need here is support, managerial and a political will to support a wide communication strategy where we involve those people on the ground that are best placed to help in our situation now.
Sabina Stoitsova, epidemiologist and part of the national COVID surveillance in Bulgaria, and Janina Steinert, Professor for Global Health at the Technical University in Munich. Thank you so much for your time. Time for one of your questions now. Over to Derek Williams.
What's the best approach in talking to people who have adopted conspiracy theories about COVID-19?
Talking to people who've adopted conspiracy theories, especially if they're people that you care deeply about, that can be a very difficult and delicate matter. But there are a few approaches that pretty much all of the experts in this field agree on. The first thing is that it's important to remain calm, even if you feel like screaming sometimes, because though it might make you feel better for a minute or two, screaming has never convinced anyone of anything. In other words, it's important to always treat the person that you're talking to with respect, no matter how much you disagree with their views, even if they believe in things that to you might seem ridiculous. After all, you expect that from them too, right? The topic is so charged here in Germany that the government has even published advice in the form of some fundamental recommendations. First is something that a lot of people forget, which is to solidly prepare for any discussion with someone who's adopted conspiracy theories by informing yourself first about the topic as thoroughly as you can. The second recommendation is to actually talk to the person involved. Don't have the conversation via text, and have the talk in a private setting, because the goal is not to publicly shame anyone. Third is to have an open, calm discussion where you ask questions about their opinions without acting as though you think that those opinions are absurd or stupid. Because you prepared for the conversation in advance by doing your own research, you should have a list of respectable sources, offer to share those sources, and talk about them at a future date. Unfortunately, experts in this area also mostly agree that once people go down the rabbit hole, it can be very hard to get them back out again. So don't expect instant success.
And that's all for now. Thanks for watching. Stay safe.